Here is a very familiar face in the AAFE, and let's go ahead. It's time for her botulinum toxin injections, and we are going to go ahead and make sure she's all cleaned up. We've marked exactly where we want to place these injections. Now, take a close look at her. We are doing the Frontalis muscle right now using ComfortDoc syringes, the most comfortable syringes on the market, but take a look at how we've distributed this, but more importantly, we are using a light dosaging. Why? Because she has shallow set eyes. If she has shallow set eyes, you've got to be very light on your dosaging because that frontalis is the only thing that's holding up those eyebrows. She doesn't have any kind of a bony orbital rim that's going to help with that support. So you've got to go light on the frontalis muscle to get the best result. Now, the procerus and the glabellar to treat those frown lines. We are going to go ahead and place this very carefully. You do not want to get eyelid ptosis or eyelid drop by botulinum toxin going into the wrong muscle. So look how we are grabbing that corrugator muscle and holding it tight and getting our thumb underneath it so it's only going into that muscle. And also look how comfortable the patient is because we are using ComfortDoc syringes. A new syringe for every single area, and that is the best practice because that's what's most comfortable. These are 31 gauge multi-bevel, sharpest syringes on the market. What does that mean? That means they feel great to patients. Always wiping everything up and away from the eyes, especially with her because she has such shallow set eyes. These are challenging patients, and it's easy to get an eyelid drop and eyebrow ptosis and eyelid ptosis for this. Now we're going to the crow's feet. Please always go ahead and inject this away from the eyes. It boggles my mind anytime someone injects towards the eye. It makes no sense at all. You can see she has just had some lifting thread treatment as well. So we do multiple injectables at one time during the appointment, and most patients would want as much as they can possibly get anyway when they come in to make it more efficient and to get the best results. So look at that lifting thread. We'll show you some of that in another program here. Now we are going with the chin. She is getting a little bit of a cobbly chin, overactive mentalis muscle. A lot of it comes from wearing masks, and you can see we are delivering some botulinum toxin. This is a very tricky injection. You've got to make sure that you are in the exact spot. If you're too high, then that mentalis muscle is going to do some really weird things, and the patient will not be happy when they go ahead and smile. This is also going to create a beautiful chin just with botulinum toxin injections, even without filler there. And take a look at her cheeks. You can appreciate that too, that she's had some filler. Now we're going to do the micro botulinum toxin or micro Botox lip flip by going ahead and injecting tiny amounts of botulinum toxin in a very, very shallow plane and taking out the superficial fibers, or really relaxing the superficial fibers of her orbicularis oris muscle, allowing the deep fibers to be active and even recruit and be a little bit more active. And that is going to kind of push that lip out, the vermilion red part of the lip, going to push it out and up and give her what is called a lip flip. She actually does not like a filler in her lips or very minor amounts. She would much rather have the micro Botox lip flip to do this more naturally because she's got nice lips already and she's not into the really big lips. This is the way to do it. You've got to really understand the anatomy. Anatomy is everything, technique is everything, safety of everything, and that comes with AAFE, live patient CME certification training, and that is really what will get you the best results on her. Now, she's had Masseters treated before. She started with these really big Masseters, but over time and over continual treatment, she has got this beautiful heart-shaped face with everything that we've done, and that is Masseter and temporalis injections, because she does have oral facial pain. And truthfully, that's initially what she came in with, and she had all kinds of trigger points in her head and neck that we take care of, and these are the things that we teach in the TMJ oral facial pain trigger point therapy certification course as well. But now she just needs these every 3 to 4 months, and this is in her temporalis muscle that gets rid of all of her headaches and that is enough for her right now. So between temporalis and Masseter, now temporalis is not going to give you any aesthetic effect, but certainly the Masseter is, but it's also going to give you this beautiful combination of her looking great and feeling great, and it doesn't get better than that with botulinum toxin treatment. But look at all the other things that we can go ahead and do with botulinum toxin and with PDO lifting PDO threads. This is the VSoft Lift brand, and with dermal fillers, the one of your choice. Now, Masseter injections make sure you are right between the anterior and posterior borders of the Masseter. If you're too anterior, you can have some significant problems with the patient's smile. So you've got to make sure with all of these. Botox is precision treatment, and that is, I think, something that is missed for all of it. But you've got to take the anatomy into account. You've got to know exactly where you are. That's how you get the best results, as we described with the shallow set eyes, which nobody talks about except the AAFE. And here you see the before when she initially came in to the AAFE Training Center to where she is today, and it's a combination of multiple treatments. It is time for you to learn Botox, fillers, PDO threads, and get AAFE certification. Train today. Real See Me certification. Time for you to get AAFE certification. Train today and add all of this to your practice right now.